Coverage you can count on. Way 31 News starts now. This is breaking news.
Good morning. We'll be brief today, and I think that's good that I'll be brief. That means there's not a lot of things to talk about. In Madison County today, we only have 4 inpatients in our facilities and 2 more in Crestwood, so a total of 6 patients that are inpatients in the county. For Huntsville Hospital Health System, the peak that we had at one time was 13 inpatients, so we're down to 4. That's very good. We have several other patients that are under investigation, but won't know their status until those tests come back. Yesterday we tested across the region only 250 people. That's down from well over 400 when people were more people were seeking tests. About 175 of those were here in Madison County. We've tested 75 at our flu and fever clinic, and we're capable of testing up to 200 at that clinic. So again, volumes are down. That's a positive sign. We also, working with Thrive in the city of Huntsville, we went and tested 50 homeless, and we plan to go back and do that every day next week to try to help that population, make sure they're being taken care of. The hot spot in North Alabama is Marshall County. We have 2 facilities in Marshall County, one in Albertville and one in Boaz. They have 70 cases in the county, and those have been trending up fairly quickly. They are not converting to inpatients. We only have 2 inpatients in Marshall County. We had 3 yesterday. We discharged 1 last night. I think some of you might have covered that on your on TV last night. It was a very nice event that they had for the gentleman who was discharged. Supplies look good at current utilization rates. We're always concerned about supplies in a situation like that. Spend a lot of time trying to make sure we have adequate supplies at current utilization rates. We feel good about our supply chain. But like everything that I give you in one of these press conferences, they could change quickly if we don't continue to pay attention to what we need to be doing. Our morale throughout our system continues to be good. We are still taking care of a lot of non-COVID patients. On any given day, we'll have somewhere in the neighborhood of 800 patients in our hospital, and system-wide, we only got 10 inpatients. We got 10 additional inpatients, 14 total. So 14 out of 800 patients are COVID. Still a lot of people out there seeking care, and our team's doing a really good job taking care of them. With that, I'll close.
Thank you, Mr. Spillers. Now we'll go to Mayor Paul Finley,
All right,
City of Madison.
Thank you, Jeff, and mine will be equally as short, but as always, on behalf of Mayor Tommy Battle and the Huntsville City Council, County Commission Chairman Dale Strong, and the Madison County Commission, and my Madison City Council, I wanted to pass along a couple of quick things today. I went back and reviewed my notes over the course of the last week, and then kind of thought about on Friday and talked to the team on what are you guys seeing and what else would we want to pass along. I'm going to start with, again, we've talked about this before, but be very careful. There's a lot of scams that are still out there. As folks talk about the fact that here comes our $1,200 next week, you know, we're seeing, and there's a lot of opportunity for folks to take advantage of that. It's the materials that you may be able to get. It's the kits that you might be able to buy. We see emails. We see text messages. There's phone calls. And just everybody needs to be very careful about anything that they would click on or enter on an unknown source. We talk about the Better Business Bureau, who has a lot of stuff on their website. They also will be back in Monday. You can call them at 533-1640. Just be careful as far as what we're doing there. Secondly, a lot of folks still calling City Hall because they are scared that they haven't been able to renew their tags. Just so you guys know, they are given some leniency on March and April, but you are able to do that online, and we continue to talk about the fact that many of those services can be done online. If you're looking to renew some tags, you can go to MadisonCountyAL.gov and then go to the license department, And I highly recommend that if you are capable of doing that right now, if you have a March or an April tag, you go ahead and get that done, because as you can imagine, when it does open back up, it's going to be awful busy, and a lot of us can do it that way. Mine's in April. I will do it by mail. I usually don't, but I will. But let's go ahead and take care of that. And then lastly, you know, one of the questions that we're starting to get, and we're definitely all talking about, is how do we reopen? How do we bring what we've brought back and constricted down back open again? And it's one that our entire team continues to work on, from the municipal governments, the county government, our hospitals. I can tell you Redstone Arsenal and the team there with Colonel Smith, with General Daly, they continue to be strong team members, and collectively, collaboratively, we're going to figure out a game plan. I know Mayor Battle and I are on the Big Ten Mayor's Call, where we continue to be able to speak with the governor and her entire cabinet on many of the things that we want to pass along to them. We've taken their guidance. We'll continue to listen to ADPH, to CDC guidelines, our hospitals. The key is finding the right time frame to do that. And again, as we constricted some of this down, I have a feeling we'll open it back up in a way that makes sense. And then I guess quickly just to reflect on this special weekend and you know, Easter and Passover and what's so important to so many of us. And I reflected this morning as I was kind of making some notes that typically I would be headed up to Kentucky to be with family, to enjoy my brother and my sister and their families, and be there for my mom with a big social gathering, I guess as big as our family can be. You know, we'd go to church tomorrow in the church that my parents were married in, that I was baptized in. And that's changed, and that's changed for a lot of us. And I can tell you, in my case, I kind of had a mad and a sad feeling about that. And so, you know, we're talking about, if you go to Easter, you know, the excitement and the activity of the E and the A, and the S basically goes to social distancing. You know, the fact is we have to social distance, and so much of what we all enjoyed, in essence, kind of, if you look back, is going to be the savior of many of us as far as lives, and also coming through this as quickly as we can. And so if you go to kind of the T of that, it's the tolerance. You know, we all have to be tolerant of our feelings and give ourselves the benefit of the doubt that this change is hard. And we constantly want to try to blame somebody. You get mad, you want to blame somebody for that. And there's no blame in this. You know, we're all working through this together. It's different, and you know, it's not a Republican, it's not a Democrat. It's just simply a disease that we all have to work through, and we have to be tolerant of that. And I think the neatest thing about our community is just how accepting we are. You know, so many of us have moved here in the last 5, 10, 15 years, and every time I talk to folks, they said, my gosh, it's the nicest, open community, and we continue to be that way, and we need to be tolerant of ourselves and tolerant of others. There is no blame. Let's work together to get through this. The E to me is encouragement. I encourage each and every person to continue to find the positive, not the negative, to work together. There's all kinds of different new family traditions that are starting. In our case, 4 o'clock tomorrow, it's another Zoom meeting with all of our family members. It's kind of become fun. It's not the same as it's been before, but it's definitely something that continues to bring us together. And then, you know, the R to me is in essence, and it goes back to this special weekend, it is a rebirth. It's the fact that this community that's so strong, that has so much to look forward to, is going to come back out of this bigger, better, and stronger. So I guess as I look at Easter and the special time that it is, it's one that from a family standpoint, we're going to be doing it differently, but we're going to be doing it in a way that's different and new. I know you guys will be too, and I encourage each and every one of you to lead your respective, yourself, your family, and again, find a way to be positive about this. It's not easy, but we're working together to get that done. Your community leaders are unified. We meet and talk each and every day, but we're going to work together to come and find that balance of keeping us safe while opening back up our community. So happy Easter to everybody. God bless each and every one of you guys. And I thank you, each and every one of you that's paying attention to this and continuing to do what you can do to be a positive impact in our community. With that said, Jeff, that's all I have.
Thank you, Mayor Finley. Thank you for watching today. We will be back Monday, April 13th at noon with another daily briefing. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we will take questions. Again, as you come to the mic, please identify yourself and who you're affiliated with, and we'll take one question and a follow-up.
Okay, so my question is for David. I'm Casey with Way 31 News. So the question is, are you using projection models to prepare for the incoming coronavirus surge, and if so, how?
Yes, we've looked at a variety of the projections and then created our own based upon the methodologies those different models use, and then looking at our trend lines. And you know, I think they're all wrong. So we've looked at worst case scenario. We're looking at what we think is the expected case scenario that would show us that would actually show a peak in about a week to 10 days towards the end of April. If we keep trending like we are today, though, we're not going to peak at the end of April. If people will keep doing what they're doing, the numbers are not going up, and that's great. So we have prepared for a peak. We have prepared for a peak that's our large hospital can hold 1,000+ patients. On any given day, we could take an extra 500+ patients in that hospital, and then we've got Madison and other locations. So we're prepared for a massive number of patients. I don't think we're going to get them. Hope we don't get them, but we spent a lot of time preparing for that just in case.
One more follow-up question. We have been receiving some emails from some people who have been saying there's a lack of PPEs at the hospitals and that kind of stuff, and some of them are having to use the same mask for more than one shift. What's kind of the update from you guys on the protective equipment that you have?
Yeah, we're in pretty good shape for supplies. By next week, we should have some additional shipments that would allow us to give the people who are not working in the clinical areas reusable masks. The people that are working in the clinical areas and working with patients that are infectious are getting all the PPE they need. Some of the people who are not working in clinical areas are not getting all the PPE they need, but just because there's been a limited supply. So the community's been gracious. They've given us a lot of reusable masks. We've tried to hand those out. Hopefully next week we'll have enough that everybody who wants a mask will be able to have a mask, and it'll be reusable. But I assure you, anybody working in a clinical area that needs a mask has got access to that equipment.
Thank you.
Thank you.
Mr. Spillers, Dave Brazelton, WAFF 48 News. We understand there have been some layoffs at Huntsville Hospital. Could you tell us about that, and how long will that last? And my second question can go to Jeff and Mayor Finley. Preparing in a pandemic for severe weather that we're going to experience tomorrow. Thank you.
Yes, we're like every other organization that's seen a significant drop in the number of people that we're taking care of. So there are areas in our hospital where people are not working right now. We've tried to address that by allowing them or working with them on how they could take advantage of some of the generous unemployment benefits that are available right now if people are not working. People who are not working who have been there for any period of time would also have earned time off that they could take during this period. We hope it's a very short period of time, but when you're set up to take care of at least twice as many patients as we're currently seeing, in virtually no outpatients, all of our outpatient services are closed down. There's nothing for those people to do. So my guess is about 2,000 out of our 15,000 employees have been affected to some degree, and our goal is to get them back on working hours as soon as we get patients back and have something for them to do.
Yeah, and you know, we're typically doing the same things that we always do when severe weather is possible. We'll be participating in another briefing this afternoon to try to get the latest information on what it may do tomorrow. You know, I think we are looking at pretty good possibility of severe weather tomorrow. We will monitor that. We'll start monitoring early tomorrow morning with the first wave to see what it's doing west of us. You know, and if it looks like it's coming this way, we will certainly be in, and we'll activate our ELC as well as our other partners that come there. And you know, it's really kind of a wait and see right now, but we are prepared for it, and we will put those things in place if needed.
Paul Gaddis from AL.com. Mayor Finley, I wanted to follow up a little bit about what you were talking about with talking with the Big Ten mayors and the governor's office, and the process of how you begin to live life again, so to speak, economically anyway. I realize this is an open-ended question. You probably talk about this for an hour, but could you sort of summarize the feelings from the mayors across the state, and what factors or what metrics will be looked at to look at possibly loosening things a little bit?
Yeah, and I think one of the balance that the governor did is, as you're trying to keep anything open that you can, and a lot of it has to do with, you know, not only the municipalities who live off sales tax, but also the businesses and those employees who were either going to have to shut down the business or go on unemployment. So there was an initial discussion on, you know, watching the numbers and making good decisions based on what we were seeing and what reality was. As we continued to start to see numbers go up, you saw the governor start to continue to constrict the opportunity for people to get together. And it finally got down to last Friday where they put the stay-at-home, where she put the stay-at-home order. So I think as that's all occurred, it makes sense to us based on what the community was seeing and the state was seeing. I think on the other hand, that's going to, as we work through this and you start to see things go down, you're going to start to see discussion on how do we bring that back up, you know. And I really appreciate folks like Redstone Arsenal and General Daly and Colonel Smith. We talked about it today. They're working hard to work with this community to kind of do it all together. So we constantly share information and have the opportunity to talk with the governor and her cabinet on all the different facets that go along with that. We'll continue to give them that information, but it's going to balance the health versus the, you know, economics, and right now health is a little bit higher than economics, and again you'll start to see that switch a little bit.
And just that was sort of going to be my follow-up, and Mr. Spillers, please chime in here if you want to, but you know, the stay-at-home order has been in place for about, well, a week today, and the numbers have slowed down, but as the numbers slow down, maybe because of some of these measures, even before the stay-at-home order, how do you risk, or how do you balance, or how do you think through reopening when that reopening may cause the numbers to rise back up again?
Yeah.
Yeah, speaking from the healthcare perspective, you know, there are a lot of people out there who are waiting on elective surgeries that might be in significant pain, you know, they really need to get those things done at some point, and probably sooner rather than later. We're perfectly capable of taking care of those patients today and keeping them separate from COVID patients and treating them and not having to worry about infection control issues. Problem from a healthcare perspective is supplies. And you don't want to utilize supplies on elective patients if there's still hot spots around the state that might need our PPE, sedation drugs, and those types of things. So I think we need to be real thoughtful about when we start doing that, when we start opening up the economy. I think we need to ease into it the same way we kind of eased into home at play, you know, staying at home, and be real thoughtful about what we open, when we open it. I think when we open, we're going to have to continue to do some distancing. We're going to have to continue to wear a mask. So from the hospital perspective, it's all about supplies and drugs and making sure we got enough. When we know we've got that, we can start taking care of the pent-up demand for the people who are asking, when can I get this done, or when can I get that done? From the community perspective, looking at it from our position, the last thing we want is to open this back up and come in here and tell you, well, we've got 10 new inpatients today, and then we 10 the next, and all of a sudden we got 100 COVID patients, which are utilizing resources at the rate of about 1,000 regular patients, and then we run out of supplies. So I think we got to be very careful and thoughtful about it. I'd rather see us do it 2 weeks too late than 2 weeks too early.
And one thing I'll add to that is, and I always mention at the beginning of this, you know, the team of people from Huntsville, Madison County, and Madison that are working together. Those are elected officials. And what I can tell you emphatically is there isn't one person in that entire group that has made a decision or talked about making a decision based on the politics of that decision. Everything that's made is there's information that is shared, there's discussion that occurs, and we're able to bring that up to the next level also. And you know, you can hear folks in Tuscaloosa and Birmingham and Mobile. There's different perspectives in different areas, and I think that's what the state was looking at. What I love about our community is there's nothing that is done that is what gets me reelected. Everything is done is what's best for our community, and I really appreciate that, and I think it's why I always make it a point every time I have the ability to be up here in talking about those teammates and the appreciation I have for them.
So it's one thing I might, Paul reminded me I will add, is it can be very good here in North Alabama, but if we still got hot spots in the state, we have to think about that before we start opening up here, particularly from a healthcare perspective. So I think we'll have a lot of conversations statewide. We'll be talking to UAB, we'll be talking to Mobile Infirmary, we'll be talking to other hospitals around the state, and try to make sure that we're all ready to do this, not just our area. I don't expect a single area of the state to come up before other areas. I think there'll be, well, they may come up, but I think the decision will be made statewide, certainly not region by region when we go back doing elective surgeries and open our hospitals up. I think that would be the right way to do it too, statewide, not a single region making their own decision and just running with it.
If I could break the rules real quick and ask one more follow-up, Mayor Finley, you talked about you and Mayor Battle and Chairman Strong working together, not being guided by the politics, and I don't want you to point any fingers at anybody, but are there places in the state that are maybe more restless or more eager to move forward as y'all have these conversations, or is everybody, as difficult as it may seem to be, is everybody really kind of on the same page?
I think everybody has their own perspective when it comes to decisions. I can't talk about anybody else, and I won't. I can tell you, and it's a great question, but from our community, that's the beauty of this community. And when it comes to economic development, that's what we do. When it comes to making decisions for our community, that's what we do. And so there are different perspectives from different areas. I think there's different legislative thoughts. But in our case, again, it's the balance of health and economics. And right now, the health side is higher than the economics, and that'll eventually change, and we'll work together to bring it back.
And I would add, from a healthcare perspective, that's definitely true. I mean, there are hospitals out there that their primary business is elective surgery, so they are very interested in getting back into that very quickly as they can. And I think they want to do it safely, but they have been maybe disproportionately hurt by this because they're so dependent upon elective surgery. But the other side of that is hospitals like Huntsville Hospital, UAB, and a few others are always here taking referrals from other hospitals if needed. And if it gets really bad, they're going to get shipped to centers like Huntsville Hospital. So you got to be careful by satisfying one set of needs that you just don't create a problem that gets dumped on the other hospitals in the state that do take a lot of referrals from other areas of the region. So again, I think the hospitals in Alabama work really well together, regardless of whether we're not-for-profit, public, or for-profit. I think we work real well together. I think we'll come to some common ground on this and make some recommendations to the appropriate officials in Montgomery on how to get back into business.
At this point, we'll conclude this press conference. Thank you for coming.